So we're here today with Danny, and Danny's a patient of mine that he's a fairly recent patient within the last couple of years, Danny, I think,
Year and
something
a
like that, yeah. And Danny came to me, and his big thing is he had not had some dental treatment done because of his fear and anxiety of dental care. And would it be fair to say, Danny, that your anxiety level for dental care before we started the sedation is pretty high?
Very high.
Very high. And do you mind sharing with us where that might have come from? Did you have an experience years ago, or?
Probably 3 or 4 years ago, I had some work done at another dentist, and it was just a lot of pain, and it got worse, and I figured I'd rather deal with the pain than go back until I finally heard about this place and the sedation, and I figured if I don't have to be, if I don't remember it, it might be better. So
yeah.
I gave it a try.
Yeah, and I might add that people's fear of dental care, there's no rhyme or reason to it, and it can be little old ladies, it can be young men like Danny, it doesn't matter, and we never prejudge patients based on their fear because it's a real thing for them, and especially if it's preventing them from getting their care done, and then ultimately they lose their teeth. So we sedated you and did several teeth, so tell us about that experience.
The first time I was still nervous because I'm not familiar with it, but after that went through, I had zero anxiety coming back. It was still not my top 3 favorite things to do,
right.
but night and day.
Right. Yeah. And do you remember much about the procedure when you were sedated?
I remember you talking to me in the beginning of it, but that's about it.
And I'll also say that we don't put patients to sleep, and that's a misconception because people think you're going to knock me out to do my work. Well, no, you're never asleep. And in fact, we often have conversations with the patients. They just don't remember them. So we don't divulge what they say sometimes, but we have a lot of fun. But the patients just have no recollection of what happens most of the time, and that's your
yeah.
And so we came back, and you did a second sedation, and it was perfect.
Better than the first.
Right.
Yeah.
And I think we have yet another one scheduled, right,
yeah.
at the beginning of the year.
Couple weeks.
Good. So for you, it's completely diminished your anxiety to have dental work done, and now you get to get your care done, your dental care done.
Yeah, it's great, and I needed it.
Yeah, sure. You did. So would you recommend that to anyone that has a high level of anxiety?
I do, and I have.
Okay, very good. Well, thank you so much, Danny, for sharing your story, and again, thanks for coming.